5 signs that your heart is not doing well. Heart diseases are responsible for 400,000 fatal events every year, and that's just in Brazil. And most heart problems are silent. When they show up, they're almost always fatal. But there are 5 classic signs that indicate your heart is not doing well at all. What are these signs? Hello family, welcome to another video here on our channel. In this video, I want to show you the 5 most common signs that indicate your heart may be sick. You should pay close attention to these signs. If you notice at least one of them, go see a doctor right away. And while you're at it, leave a comment below if you've noticed any of these signs. But after all, what are these signs? What should you do if they are found? Relax, everything will be in this video. So go ahead and leave your like, give it a thumbs up and share it in your groups. And my friends, I'm participating in the iBest Award for Best Health Influencer in Brazil. So if you like my work, I ask you to give me your vote. It doesn't even take 5 seconds. You just have to click here or scan. The QR code will also be in the video description. You can vote every day until June 13th. And of course, I ask you to share this link in your groups. The body gives very clear signs that things aren't going well, and for cardiovascular diseases, this is very clear. The first classic sign, swollen legs and feet. Have your feet been swelling, your legs, especially at the end of the day? What could this be? It could be heart problems, especially heart failure. It's important for you to see a cardiologist to rule out this problem. It could also be diabetes. You might have diabetes and not even know it. Or you have diabetes and it's not under control. You should also see a doctor to check your fasting insulin levels, your hemoglobin A1C, and it could also be some kind of vascular problem in your legs. And then you should see a vascular specialist. He will probably order a Doppler ultrasound of your legs to check if there are any blockages. So, this is a very classic sign for people who have heart problems or uncontrolled diabetes. Sign number 2, Xanthelasmas around the eyes are small yellowish bumps. I'll ask to put up a picture so you can see what they look like. Small yellowish bumps, mainly in the area around the eyes. What is this, Moacir? It's a cholesterol deposit in our skin. It can appear in other areas as well, but it's more common around the eyes. This means that your lipid profile is not doing well at all. So you need to check not only your total cholesterol, but also your triglycerides. If it's not too high, if your high density lipoprotein isn't too low, and you're a polypoprotein A to a polypoprotein B ratio, okay? The problem isn't even high cholesterol, but high apolipoprotein B. So you need to check these tests. You're probably having changes in your lipid profile. I'll discuss the necessary precautions at the end of the video. Third sign, loss of hair on the shins. This is very common in people who have compromised circulation, right? The hair on the shin, there was always hair on the shin, and suddenly the shin becomes smooth. So you also need to check if you don't have any heart problems, heart failure, a blood pressure issue, or if you don't have a blockage again. Look for an angiologist to get a Doppler exam of your legs. So this is usually compromised venous return, compromised blood flow, so that's another very clear sign. It may seem like a silly thing, but when you have compromised blood flow in your legs, the blood doesn't reach the capillary bulb, right? The hair on your legs. And that hair doesn't grow. So if the hair isn't growing, it's due to a lack of blood flow. It's a pretty serious sign, okay? The fourth sign, you won't even believe it, Frank's sign. Frank's sign is a little crease that appears on the earlobe. I'll also ask to have the picture put up so you can check it out. This sign was discovered by the pulmonologist Sanders Frank. He noticed that people who died from cardiovascular problems, right? They had this sign, so it was identified that this sign shows a greater tendency toward cardiovascular disease. So, go to the mirror, check to see if you have this Frank sign. This sign isn't that specific. It doesn't mean that if you have the sign, you have a cardiovascular problem, and it also doesn't mean that if you don't have it, everything is fine. This sign is more dangerous, more complicated, the younger the person is. So, if you have Frank's sign and you're around 40-45 years old, that's a red alert. If you're older, it's not as complicated, but in any case, if you notice you have Frank's sign, go get checked by your cardiologist, right? Fifth sign, cyanotic skin, those bluish limbs, right? This happens a lot at the fingertips, on the hands, on the feet, it's bluish, right? But it also happens in other areas. It means that blood isn't getting there. It means that the vascularization is inadequate. So you might have some kind of cardiovascular problem. You need to check it out, right? This isn't normal. This isn't common. Moacir, it happens more in the cold, even in the cold, right? You can't have bluish hands or bluish feet, right? It means that the blood isn't getting there. It means that the pumping isn't adequate. It's also a sign of a cardiovascular problem. And what can you do to prevent all this, Moacir? Well, most of what I'm going to say you already know. Always control your blood pressure, keep checking it, always keep it at 120/80. Some people can go up to 130. It really depends, right? It's important for you to talk to your doctor. Don't smoke, okay? Smoking is by far one of the biggest risk factors for cardiovascular diseases and being overweight. Everything I've mentioned here, these 5 signs, being overweight makes them even worse. So you need to reduce fat, especially visceral fat. Now, the most important tip is if you notice any of these signs, seek medical help, seek medical advice, right? Your doctor might order some routine tests, maybe an echocardiogram, right? He might ask for a more advanced exam. Exactly to check how your cardiovascular health is doing. So seeking medical help if you have any of these signs is the best advice I can give you, my friends. One of the keys to having better health, more energy, and slowing down aging is smart supplementation. So, if you're already over 40, 50, 60, or 70 years old, pay close attention. Did you know that it already exists in Brazil? Before, it only existed in the United States, okay? But now there is already a line of essential supplements in Brazil that is specially developed for people over 40. And I, of course, am already over 50 and I use it. It's NutriH supplements. It has omega-3 vitamin D, creatine with enzyme, and other supplements that are specially developed for people over 40, 50, 60, and even 70. People at this age need more concentrated doses and specific combinations that are essential to protect their health, strengthen their immunity, and boost their energy. Make sure to check out NutriH supplements, okay? The NutriH link will appear, and I'll ask to put the QR code as well. It will also be in the video description. Don't forget to invest in and take care of your health, and smart supplementation makes all the difference. My friends, don't forget to check out the website, okay? www.drmoacir.com.br all together. On my website, you'll find all the supplements I use and recommend, my courses, and my other social media links. Don't forget to visit my website. And if you haven't subscribed to the channel yet, it's free. You don't have to pay anything. Just click on subscribe. Don't forget to hit the bell and make sure to select all. My friends, I hope you enjoyed it. Don't forget to give it a like. Don't forget to vote for me in the iBest Award. We need to be among the top 20 to move on to the next stage. And I know I can count on you. Remember, every day until June 13th, you can vote. In the morning when you wake up, you can think, wow, I need to leave a vote for Moacir. Then you just go there and vote for me, okay? I'm counting on you. And share it with your groups too. A big hug, my friends. I'll see you in our next conversation. Every Saturday there's a live stream, okay? Every Saturday at 3 o'clock there's a live stream. And soon our podcast will be on the air too. I'm counting on you there. Hugs, my dear friends. See you next time. See you then.